Hi, Dr. Yass here. In this video, I want to speak regarding a particular person that I treated recently who has been suffering with pain for over 10 years. And I was able to resolve the cause of that pain in 2 hours. Now, a lot of times I am sure that when people hear statements like this, they go to the concept of, well, if it sounds too good to be true, then it can't be true. But this is true, and it is true because it is constantly reproducible. So if something were to say, someone makes a dramatic claim and they can't reproduce it over and over again, that's the indication that whatever they're saying is probably not true. Also, there needs to at least be a theoretical basis for the claim. And in most cases, you could start with that, and that's not there. So that's where the idea of that thought came in, that if it's too good to be true, then it's probably not true. But in this particular case, it is 100% true because all the keys that are necessary to prove the Yass method as fact are in fact in place. And so I wanted to discuss this particular woman's situation and highlight the reasons why you really basically have no alternative other than utilizing the Yass method to get a proper diagnosis, identify the tissue in distress, and if it is in fact confirmed to be muscle, which it is in more than 98% of cases, be provided the appropriate exercises, understanding how to use progressive resistance and end your pain, and be fully functional, just as this woman was. So the backstory of this woman is that she fell 10 years ago, and she fell on her right side. And I would like to start with, first of all, describing where her pain was. And for that, I'm going to kind of have to stand up. And it was on the right side. And she complained of pain. She said her pain was here and then here, and it ran down to the front of her thigh to her knee. So again, her pain is here and here, running down to the front thigh to the knee, and had pain at the knee. So she goes through the usual process. They do an X-ray of an MRI of the right hip, and they find some arthritis. And they say that since the arthritis is found at the time she's having the pain at the front upper thigh area, and then pain from kind of the outer portion of the pelvis running down the front thigh to the knee, that is the cause of the pain, and coerce her into getting a hip replacement. Now, you kind of have to understand that if the hip joint was causing pain, the symptoms of the arthritis, or the quote unquote bone on bone that everyone is identified in having through this false use of the X-ray or MRI, the symptom of that would be pain at the hip joint. At the hip joint. So if we just look right here, here's your hip joint. And if we were looking at the front of the pelvis, which would kind of be right here, this is unfortunately kind of a back view, but the front of the pelvis is here. So this woman's having pain here running down her thigh. This is the hip joint. This isn't the hip joint. Nothing about this is the hip joint. So there's not a goddamn chance in hell that the arthritis that was identified could be creating the pain she was experiencing. Therefore, how could you say it is the tissue in distress eliciting those symptoms? Everybody has to start understanding this core principle. Pain is an indication of a tissue in distress. The purpose of those symptoms is to create conscious awareness of distress of that tissue. Each tissue emits a specific set of symptoms so that there can be awareness created of the distress of that tissue based on those symptoms so that that tissue can get an intervention and resolve the distress of the tissue. Once resolved, the tissue doesn't have to emit the distress signal of pain or altered symptom, and it ceases. So you got to look at the symptoms. So just because arthritis was found at the time this woman was having these symptoms didn't mean it was the cause. Shit, she may have had blonde hair at the time the arthritis is found. Does that mean having blonde hair is from arthritis? I mean, you got to start waking up to the scam that's being perpetuated here. This bullshit concept that structural variations identified at the cause of pain mean it's the cause of pain at the time the pain exists. It's not the cause of pain, especially when the symptoms being experienced aren't what the symptoms should be if the structural variation identified were to be in distress. If you're not getting this concept, rewatch this video over and over and over again until you fully wrap your head around this. So the woman ends up getting a hip replacement that was completely unnecessary. And due to the post-surgical symptoms of swelling and pain, take a wild guess. Does she increase her strength and her weight bearing on the right side? No, of course not. So she ends up excessively weight bearing on the left side, ends up having some left knee pain. What do you know? Arthritis is identified. She gets a left knee replacement. Time continues to go. She's becoming more and more disheartened, extremely confused why she can't end this pain. She tries chiropractor and physical therapy and all the nonsensical crap. We move forward 10 years, and now she's still having the pain at the upper front thigh, the main portion of the front thigh leading to the knee, and she can't weight bear on the knee without pain, and her pain in the groin area, the upper front thigh and the front thigh, are completely worse when she sits for any sustained period of time. And she's being told she needs now a right knee replacement, that the arthritis identified is the cause. So let's think about this a second. So she has her pain primarily now when she sits for any sustained period of time. She's like, driving is insanity. It just kills her to drive. And it's just completely affected her quality of life. So if her pain is primarily when she sits, but if she stands, it's not so bad, she doesn't have the pain bad. So is the implication, since they're telling her it's arthritis, that she has the arthritis when she sits, but somehow the arthritis recedes when she stands because she doesn't have the pain as bad? When someone tells you that a structural variation is creating your symptoms, you better expect those symptoms to be 24 hours a day, 7 days a week, with no change in the intensity. Unless you're going to tell me that the structural variation varies throughout the course of the day, depending on activity or whatever. Does that make sense to anybody? You gotta start wrapping your heads around this if you're ever going to see your pain resolved. And if this is the best that the medical establishment has to offer, by all means, leave them. Leave them. They simply don't know what they don't know, and they're simply promoting their treatment model based on their education and training. But if it doesn't make sense, if the principles are not steeped in logic, how do you accept that? Especially if you've been getting treated for any sustained period of time and you're still having symptoms. What does that tell you? Whatever the hell they think they're doing, whatever treatment they think they're performing, clearly isn't addressing the tissue in distress. Because the symptoms you're experiencing are still there. They're still being elicited, which is telling you the tissue in distress that's responsible for creating those symptoms is still not being addressed. I mean, you got to get this stuff, folks. I'll keep going out there. I'll keep promoting this stuff. But at some point, you're going to have to grasp it, endorse it, embrace it, and take it and utilize it. So here we have this poor woman Now, 10 years down the road, being told the next step is another knee replacement. She's already tried 3 months of therapy. Nothing's worked. She's exactly in the same boat. And all she knows is that she just wants her life back. She wants to be able to do the things she wants to do. Now, it turns out that her doctor, I happened to do a podcast, and the doctor was the woman who had the podcast, and I was a guest on it. And this woman happens to hear it and says, "Oh my God, this sounds like it's logic based. It's analytical. It makes sense." So that's why she does the Zoom session with me. And the very first thing I point out to her is that the location of her symptoms is actually where two muscles exist. One being the psoas muscle, which runs from the lumbar spine all the way down through the abdominal cavity to the hip area. That's creating that very upper thigh / groin pain. And then her quad, her front thigh muscle, which attaches from the pelvis on the lateral aspect of the upper thigh across the whole main middle portion of the thigh and attaches to the kneecap via a tendon. So when you look at those muscles, if they were to be shortened, they certainly would incite those symptoms. So that's the first step to understand what tissue is in distress. She's identifying symptoms that relate to the specific locations of muscles. We're going through the process of the evaluation portion of her first session, which includes looking at things like posture and movement. And if it's muscle, we're going to look at, if it's thought to be muscle, we're going to look at range of motion of joints and flexibility. So once I think that it's her muscles, her psoas and her quads, I decide to ask her to do a test to check flexibility. So I ask her to check the flexibility of her quads on hip flexors on the left side and then on the right side. And she clearly acknowledges that the right side, it is much tighter. And most importantly, in attempting to do the stretch, we bring on the very symptom she was complaining of at the upper thigh / groin area. I literally bring on the primary symptom she's been complaining of. That's known as the oh my God, I just blanked on the word. The corresponding, for now, I'll say the comparable sign. That's what it's called. It's called the comparable sign, which is that I was able to bring on her symptom. By definition, that should tell you I know what the tissue is in distress, eliciting the symptom. So that was a major thing that rang out. It was very exciting to see that. Then I had her stand, and I was looking at her standing posture, and it was remarkable to see when she was standing, her nose was not centered between her legs, but it was completely over the left leg. She was basically weight bearing with almost no weight on her right leg. Her right leg was almost basically there just for balance, not weight bearing. And she was stunned when I took the picture and showed it to her. So altered posture, another indicator of muscle, has nothing to do with arthritis or joints or any of that crap that these people are trying to promote because that's all they know. The fact that her nose was directly over her left leg and not her right leg is a corroborating sign of a muscular deficit creating her symptoms. Then she walked, and every time she put her weight on her right foot, she would sway to the right, which was an indication that she could not support herself on the right leg, another indication of weakness. And she was simply trying to shift the weight to the other side of her body so that her right hip muscle didn't have to support that weight. So beyond the pain that she's experiencing, look at the other corroborating symptoms: a major loss of range of motion and flexibility, the ability to bring on the symptom through a flexibility test, a postural variation, a movement pattern variation. Every one of these are corroborating signs to indicate that this has nothing to do with any structure. It's clearly muscular. The fact that she has it only when she sits and when she stands, it basically goes away. It's activity based. What tissue is responsible for activity? Muscle. Muscle. So for 10 years, she's been being treated and never got better because not a single person identified the cause of her pain as coming from muscle. That, to me, in my mind, is criminal. I don't know any other way of saying it. How can an institution be allowed to sustain when the gross evidence, obvious evidences of a muscular cause, and yet for 10 years, a decade, they continue to promote that the cause is coming from varying joints, first the right hip, then the left knee, then the right. They'll probably try to replace every one of our joints if given the opportunity. And when you wonder, how is it possible that all these illustrious doctors can't figure it out, but one individual can, it's because muscular causes don't show up on diagnostic tests, and these people aren't educated or trained to identify muscular causes. And what's more psychotic is I have shown over 28 years that in more than 98% of cases, the cause is muscular. Wrap your head around that concept. You don't have to take my word. Just think about it. If you have attached your pain to doing some sort of task or activity, doing it brings on the symptom or worsens it, you've just identified it as muscular. End of story. You could bring that information to anyone in the medical establishment. They're not going to listen to you because they don't even know what you're talking about. You have to start recognizing that the Yass method is outside of it all. Outside of it all. It is not just a treatment model such as physical therapy and chiropractor and massage and acupuncture and Pilates and yoga and Feldenkrais and Agashku and all this other crap. You need a diagnosis. You need to know what tissue's in distress before you could ever get a treatment, because how would you know what tissue to treat? The Yass method helps to identify it. And if it is structural, in the less than 2% of cases, the symptoms will present that too. And I'm more than happy to refer you to a surgeon to resolve that in those cases. You're entitled to get surgery when you need surgery. The problem is that the mechanism by which diagnoses are derived by the medical establishment using X-ray and MRI leads to about a 95% false diagnosis rate. Think about that. 95% of those people getting that X-ray and MRI coming up with some structural variation, your physical presentation of symptoms clearly would indicate whatever was identified isn't creating those symptoms you're experiencing. That's a misdiagnosis, and yet you'll be treated, here you go, like this poor lady, for a decade. And they'll go 10 decades. They don't give a shit. I mean, they're going to just keep doing what they're doing again, because they don't know what they don't know, and they're going to only do what they're educated and trained to do. That's how it works. I had the same education. I, on the other hand, saw it as worthless, baseless, inept. And I said I needed to come up with an alternative, something on my own that would help me to understand how to properly diagnose and treat pain or other symptoms. It's one thing to talk theory and you're in medical school and you're in classes. It's another thing when a person's standing right in front of you and all of a sudden the rubber has to meet the road. That person's looking at you and saying, I'm in pain. My life is being disrupted. Please help me. Well, it didn't take me long to know that what I was taught was never going to help them. And I had to come up with an alternative. And that's what I did. And that's what the Yass method is. So I hope this is an example to those that get a chance to see this video to recognize you can lose a decade of time if you stay within the existing medical establishment, regardless of the specialty you go to. I don't care. Muscular causes, which account for more than 98% of cases, are not part of the medical establishment, period. It's end of story. You need the Yass method. You need to get a Yass method Zoom session, because you don't have to come to Jacksonville, Florida. This could be done anywhere in the world. You pick the day and time that's most comfortable for you. We have the session. The sessions are videotaped. You establish what the tissue is in distress. If it's confirmed to be muscle, I'll show you the specific exercises to do. You perform them under my supervision. You understand how to use progressive resistance to strengthen the appropriate muscles until the force output of the muscles is greater than the force requirement of your activities, and you're pain-free and fully functional for the rest of your life as long as you sustain it, right? The Zoom sessions are videotaped. So you take that going forward for the next, after the first session, 11 times. You're going to do your exercise 3 times a week for 4 weeks. So you're being supervised every time you do the exercise because you're doing it to the video. That increases the chance of accuracy 1,000-fold. Then you get your 4-week follow-up session, and we make sure everything's going in the right direction. You're achieving your goals. You're seeing progressions in your function. You're seeing reductions in your symptoms, and we make sure this continues. We take this to the point until you know for sure that you are either fully functional and pain-free or close to it, and that you can control how to perform the exercise and utilize the proper resistance until you have it. You're empowered. You don't need anybody else. You have the control to sustain resolution of symptom, if that's where we get to, or at some point you'll get to, and be able to do whatever you want in your life as long as you sustain the appropriate strength. This is no different than the person who thinks, oh, I need to be smart. I need to read a lot. Well, no one could read for you and you get smarter. You're going to have to read. Well, no one's going to make you stronger. You have to make you stronger. If you're associating your symptoms with function, trust me, there's only one reason you're having a symptom, and that's because you don't have enough force output in all the muscles responsible for the force requirements of your activities, period. End of story. You need guidance. You need to understand that it's muscular. You need to understand which muscles are responsible. You need to know how to do the appropriate exercises for each muscle, and you need to know how to utilize progressive resistance. But after that, it pretty much is up to you, and you kind of need a little checkup every 4 weeks just to make sure everything is going in the right direction. That's why I set this method up the way. I think it's the most economical way that this could be done. If you look at it per time you do your exercise, this is costing $18 a session every time you're doing your exercise. $18. That seems like a great deal to have the supervision necessary to be able to achieve everything you're dreaming of, especially for someone like a poor woman who for a decade has basically languished because of ineptness and now has the opportunity to get out of her symptoms. So this is the path. I highly recommend you schedule a Yass Method Zoom session. If you want to contact me about it, you can contact me by email. The email address is drmitch@mitchellyass.com. It'll be in the description. To schedule a Yass Method Zoom session, you could go to livewithoutpains.com/sessions, livewithoutpains.com/sessions. Again, it'll be in the description. You'll learn about the Zoom sessions, what you could expect, what they look like. And when you're comfortable and feel like you're ready to schedule your session, schedule a session for the day and time that's most comfortable for you. Okay? If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, and would like to subscribe to get notifications when new videos are added or when I'm live on YouTube, please do so. Let's work together. Let's end this epidemic of chronic pain by recognizing there's a reason for the epidemic, and it is an ineptness of a system, a core deficit in how diagnoses are achieved. You need to step outside the system. It's the only way you're ever going to get the right diagnosis, and it is really sad and disheartening for me to say, you could end up like this woman 10 years before she finally came to the Yass Method, and now she's on her path out of pain and will regain her function and be able to do everything she wants in her life. Please join me. Let's work together. Let's end your pain and allow you to reclaim the life you so justly deserve. Okay? For now, Dr. Mitchell Yass, wishing you a pain-free, fully functional life. Bye-bye for now.